Hello everyone, I'm Christopher Kent. Your November 2012 issue of On Purpose is on the way. We've got some excellent science articles for you in this program. The first is immediate neurological improvement following subluxation-based chiropractic care using torque release technique. In addition to the case study, this article includes an excellent overview of torque release technique. Next, by Drs. Dickholz and White, the paper Improvement in Quality of Life, Sleep, and Attention in a Patient with Attention Deficit Disorder Undergoing Upper Cervical Care. Another example of how upper cervical subluxation can assist in cranial nerve problems is the paper Resolution of Trigeminal Neuralgia in a 14-year-old following upper cervical chiropractic care to reduce vertebral subluxation. We also have pediatric cases describing resolution of chronic otitis media, difficulty sleeping, and tactile sensitivity in a child undergoing subluxation-based chiropractic care, a case study on a 6-day-old neonate with breastfeeding difficulties and breastfeeding jaundice, and a pilot case series involving 19 cases of infants with breastfeeding difficulties. In addition, we have several stories on heart rate variability. This allows us to objectively measure the balance between the sympathetic and parasympathetic nervous system and look at how effectively an individual is adapting to the environment. As you know, chiropractic care has been shown to improve heart rate variability, and these papers show even more dimensions of the significance of this in one's health. Heart rate variability predicts emotional flexibility in response to positive stimuli. We also have a meta-analysis of heart rate variability in neuroimaging studies discussing implications for heart rate variability as a marker of stress and health. With metabolic syndrome and obesity being epidemic in our society, we discuss a paper on the relationship between heart rate variability and adiposity. And we also look at the languages of the brain. In politics, we address the issue of drugs. Should chiropractic remain drug-free? This is an excellent essay by Bill Esteb of Patient Media, and I think you'll really enjoy it. We also review how the ACA has been advocating for New Mexico's chiropractic right to self-determination, and how the ACA filed an amicus curiae brief with the New Mexico courts in an effort to permit them to decide whether drugs should be included in their scope of practice. On the positive side, several states, including Georgia and Iowa, issued proclamations of Vertebral Subluxation Awareness Month. And finally, in philosophy, learn about wellness and chiropractic in the corporate environment from people who have been there, Drs. Mike Reed and Shireen Van Wagner. I'm sure you'll find their program fascinating, inspiring, and practical. So stay focused, share this information with your patients and community, use the news releases, and if you're not using On Purpose slides, have a look at how they can turn reception room time into a positive learning experience for your practice members. And remember, when you're on purpose, you are not alone.